Feeding is a social event. It is important to leave the privacy curtain open while feeding patients to encourage socialization and promote appetite. This skill will start with the opening. Knock and identify the patient. Introduce yourself by name and title. Describe what you will be doing and obtain permission. Leave the privacy curtain open and wash your hands. Offer the patient a hand wipe to wash his hands before eating, and collect the wipe with a paper towel to prevent contamination of your clean hands. Discard both the hand wipe and the paper towel into the trash receptacle. The prepared food tray will be on the patient's overbed table. Make sure the patient is sitting straight up in the chair and place the towel over their chest. Sit in a chair opposite the patient. Offer a drink before eating, and if desired, hold the cup of water to the patient's lips, carefully controlling the flow of water. Remove the lid from the food container. Use a spoon to gather a small amount of food onto the front portion of the spoon and place the spoon in the patient's mouth. Do not use childlike techniques like car, train, or plane sounds when feeding an adult. Talk to the patient during feeding, allowing time for the patient to chew and swallow between bites. Offer another sip of water every 3 or 4 bites. Allow the patient to set the pace of eating. The spoon should be less than half full. Do not make the patient feel uncomfortable or rushed, which can cause them to not eat well and possibly affect their overall health. Repeat the feeding process, offering frequent drinks until the patient is finished or declines more. Socialization is a very important part of feeding any adult patient. If the patient declines food before the meal has finished, encourage him to eat more by offering another bite. You can further encourage a patient by asking if he would like something different to eat and offering another drink. When the patient is finished eating, take the food tray to the sink and empty the contents of the cup into the sink and throw the cup, food container, silverware, and napkin away. Return the tray to the overbed table. Wipe the patient's mouth with the towel. Remove the towel and place it in the soiled linen container, being careful not to allow it to touch your uniform. Ensure the patient has his call light and the patient's environment is neat and clean, and ask if he needs anything else. Wash your hands. This skill requires documentation. Document the amount and type of food eaten onto the documentation form provided at the beginning of the skill. This illustrates a sample food intake form and indicates the patient was fed a snack, and he ate approximately 25% of the snack and drank approximately 25% of the water. The form then needs to be signed. After documenting, make any corrections necessary and tell the evaluator your skill is done. Need scrubs for your new career? Visit foryouruniforms.com and enter the code CNA Video for a special discount. Need additional resources? For Your CNA has what you need. With practice tests, an online workbook, instructional videos, practice kits and supplies, and our very own skills book with step-by-step instructions, you will feel confident when you take the CNA exam. Visit foryourcna.com today. Continuing education for CNAs are called in-services. In-services are now offered online at foryourcna.com.